Muscular dystrophy is a genetic disorder in which abnormal genes lead to muscle degeneration. Most forms begin in childhood, and their damaged muscles become progressively weaker. Patients eventually need a wheelchair, will have trouble breathing or swallowing, and lifespan is often shortened. Duchenne muscular dystrophy occurs in boys. There's a new therapy that has already had positive results from the first clinical trial. Researcher Dr. Linda Marban in Los Angeles discusses muscular dystrophy and the new innovative treatment to help improve the lives of these patients.
Muscular dystrophy is a disorder that primarily affects boys and then ultimately young men. It's a genetic disorder that affects the muscles. And what happens is a boy is born with it, and the muscles slowly die. So while most normal healthy children achieve milestones as they grow, boys with muscular dystrophy lose their milestones as they grow. So the first thing a mom might notice is that her son is not able to walk like he used to. And that might happen at about age 3. And then they put them through a series of tests in which they find out that they have this disease called muscular dystrophy, which is a muscle wasting disease. And what means is that the muscles slowly die, and the trunk muscles die, the leg muscles die, the arm muscles die, eventually the respiratory muscles die, and the heart muscle ultimately dies, and so that is typically when they lose their lives. And most patients with muscular dystrophy, Duchenne muscular dystrophy, the type that we're working on, die somewhere between 20 and 25 years of age.
Dr. Marban discusses results of research to fight this disease.
What we're working on is an innovative therapy for Duchenne muscular dystrophy. It's a cell therapy, which is really sort of taking medicine by storm right now. And it's the most exciting time perhaps in the history of biologics, because we're able to harness the power of cells and use them as a therapeutic. And our cells work as what I like to call a 1-2 punch in treating muscular dystrophy. We are attacking the inflammatory processes that occur, so the inflammation and sort of the rampant breakdown of muscle causes a huge inflammatory response. And then our cells, after they clear out some of the inflammation, are allowing new muscle to grow. This is not a stem cell. The cells that we are using are actually called progenitor cells. Our cells are muscle cells. And when you think about it, it's perfect. We're using muscle cells to treat a disease of muscles. We get them from the heart, and then we use them to treat all types of muscle diseases. The most exciting thing here is we've been able to harness the power of the cell without having the cell have to take up residence and live in the tissue. What we're hoping to accomplish is to attenuate the progression of the disease. So as I mentioned, this is a progressive disease. The boys go from losing their ability to walk, to losing their ability to breathe on their own, to losing their ability to feed themselves or use the bathroom. What we're trying to do is slow that progression and maybe reverse it just somewhat, so that the boys and young men have a better quality and quantity of life, longer lives, healthier lives.
Research is continuing into clinical trials for Duchenne muscular dystrophy.
We're at the most exciting phase of our research. We are at the point at which we are treating the patients with our cells, and we're doing what we call a randomized, double-blind, placebo-controlled trial, which is the most rigorous type of clinical trial that the Food and Drug Administration asks people to do. And what you basically do is you compare your therapy against a blinded placebo or saline, and you see if your therapy makes them better.
Dr. Marban is looking for people nationwide to participate in this new HOPE-2 trial.
We're looking for boys and young men that are in the later stages of the disease process, and therefore can go to their local Duchenne center and look to see if they would be a candidate in our trial. They should also look on clinicaltrials.gov, which will give them the inclusion criteria for the trial. That means, do they fit into the treatment paradigm that we're looking to fulfill? And then they might have an opportunity to join the fight against their own disease. The HOPE-2 trial is at about 12 different centers across the United States of America. We're using Duchenne certified centers, which means that they have all of the machinery in place to take care of these specialized patients. And so there'll be some place that's fairly close to get to. We provide travel money and also cover expenses for travel and hotel. so that the patients have an option to receive this. Look, our goal here is to make these kids better. We're going to do everything we can to do so.
Dr. Marban reveals her gratitude in being a part of bringing hope to these patients who have this devastating disorder.
It's the most extraordinary thing to take something that was discovered in a research lab and turn it into a potential therapy for human beings who are sick or potentially dying, and be able to maybe reverse that tide or stem the tide of disease. It's the most extraordinary work, and I'm grateful every day to do it.